Hi, I'm Melissa Pilion. I'm a dermatologist and dermatopathologist at the Cleveland Clinic, where I serve as chair of dermatology. And I am secretary treasurer of the American Society of Dermatopathology and lead our advocacy efforts.
I am Carl Nepakowski, dermatopathologist in Downers Grove, Illinois, and I am the alternate delegate to the AMA House of Delegates alongside of Melissa, um, and assist her in leading our advocacy efforts. So, Melissa, what are some hot topic advocacy issues being addressed by the society right now?
The three big issues that are being addressed. Number one is Medicare physician payment. This is very important to make sure that we get paid appropriately for the work that we do so that we can keep our offices open, pay our office staff, and keep our doors open for patient care. Number two, our laboratory developed testing, which the FDA is trying to take over management of and would severely limit the use and development of tests in our labs and increase the cost. The third area that we're working on is the reimbursement and appropriate use of immunohistochemical stains and other studies in dermatopathology.
Melissa, what are some threats to our subspecialty that we all should be aware of?
So a big one is the physician fee schedule, which has had a really sharp decline over the last 20 years, especially compared to reimbursement for other services like hospitals and long-term care facilities. And over time, that whittles away our margin, it whittles away our what we pay our employees and our staff and our how we can keep our practices thriving. So that's a really important issue that the House of Medicine is activated on right now. The AAD and CAP are both advocating in this issue, but I think it's something we really need to be aware of and be ready when there's a call to help in that, to raise your voice to your congresspeople, to send emails, to talk to use your network to help advocate for that. Be ready and really answer those calls, and that's how we can be successful. So, second issue that I think we should all be aware of is the appropriate use of immunohistochemical stains and other studies. Insurance companies are really monitoring how we are using these studies. They have a lot of data on how these studies are used and what would be the right amount. And the right amount varies from case to case. We understand that, but we need to help create some parameters for what is appropriate, an appropriate range. And the ASDP is working hard on that, trying to collect data, publish papers, and give some good, solid evidence of what is the appropriate use of immunohistochemical stains. The third threat is lack of engagement by physicians in advocacy and in the House of Medicine. We really need everyone to stand up and say this issue, fight on certain issues. And when you receive that email, don't ignore it. Quick response would be helpful. Join PathPack, SkinPack, AMPAC, so that your money can be used to help influence the way Congress legislates on medicine. So, Carl, how can members advocate for our specialty?
Yeah, there's a number of ways. I think the most important thing is to maintain your membership in the specialty society, so in the ASDP, and then the parent societies, the American Academy of Dermatology, the College of American Pathologists, and then, of course, alongside those specialty memberships, make sure that you're a member of the American Medical Association. So that's sort of like a passive way. I mean, it costs a little bit of money, but that's a great way to stay connected at least and to support the efforts of those who are more active. And then to get more active, the best thing you can do is you can financially give to the PACs. So there's Skin Pack, there's Path Pack, there's AMPAC, and those dollars directly turn into essentially influence for the things that Melissa just talked about and the things that are being worked on really hard to help us keep the lights on, keep being able to serve our patients, particularly our most vulnerable patients. And then other things that can be done more directly. When those emails come through from AAD and CAP and they ask you to just, put in your own 2 cents and just fire that email off to your legislators, do it. Don't hesitate because we all know, like, if we wait or put that off, say, oh yeah, I'll do that tonight or something like that when I get home. It takes like 2 minutes to just do it right away when you get it. And as those roll in, they really do help. So make sure you're active that way, and then finding ways to meet with your legislators, doing having them come visit your lab or your clinic, and finding ways to get appointments with them or their staff are other great direct ways um, to advocate for our specialty.